Ever had that really deep, annoying pain right where your glute meets your hamstring? You know the one. It's kind of right on your sit bone, and it doesn't care if you're a serious runner or if you spend most of your day at a desk. It's confusing, it's stubborn, and trying to figure out what's actually going on can feel like a total mystery. Well, today, we're going to unravel that mystery. And it's no surprise it's so confusing. I mean, just look at this picture. The anatomy around your hip and buttock is an incredibly crowded neighborhood. You've got muscles, nerves, and tendons all layered on top of each other. So as you can see here, that pain could be coming from a bunch of different things, like deep gluteal syndrome, or even some sciatic nerve irritation. But we're going to zero in on one of the most common culprits behind this very specific kind of deep, localized pain. It's a condition called tendinopathy. To get specific, we're talking about proximal hamstring tendinopathy. Now, that's a mouthful, but all it really means is that the very top of your hamstring tendon, right where it latches onto that sit bone, is getting aggravated. And a huge piece of the puzzle is often compression. I mean, think about it. When you sit for a long time, you're literally squishing that tendon. The same thing can happen if you suddenly ramp up your training or even from too much aggressive stretching. If deep squats or just sitting on a hard chair makes you wince, well, this is very likely what's going on. So what's the game plan? In a world that's just full of conflicting advice, everything from just rest it to go get an injection, what does the science actually say is the best way to handle this? To get an answer, we can look at a really important study called the LEAP trial. The researchers basically set up a scientific showdown between three of the most common treatment strategies. Group 1 got a structured 14-session exercise program that also included education. Group 2, they just got a single corticosteroid injection. And Group 3 was the wait-and-see bunch. They got a little bit of general advice and were pretty much sent on their way. So, who won? Well, the results are pretty darn striking. After a full year, 52 weeks, the winner was crystal clear. The exercise group, which you can see here as that tallest bar, reported way more improvement in the long run than both the injection group and the wait-and-see group. The science really couldn't be clearer on this. So here's the bottom line, pulled straight from the study's main findings. It's the combination of education and progressive exercise that really makes the difference. See, it's not just about doing random exercises. It's about understanding what's happening and following a smart plan that gradually gets more challenging. That's what leads to real, lasting relief. All right, so we know what works. Now let's talk about the how. We're going to walk through the evidence-based recovery blueprint, step by step. The gold standard approach is this 4-stage protocol. And listen, this is not a race. It's a logical, step-by-step progression. We start by calming things down. Then we methodically rebuild strength. After that, we prepare the tendon for more complex, real-world movement.